wisdom, word. Quality time with Najiyyah. Faith, wisdom, word. Quality time with Najiyyah. Quality time with Najiyyah.
Hey, good people. How are you on this wonderful day? Welcome to another episode of Quality Time Podcast with yours truly, Najiyyah. Oh, do we have some wonderful content for you today? We are focusing this summer on holistic wellness, and today we are talking specifically about our physical bodies. So, true to our form, I do want to open up with a scripture. And the scripture is coming from 1 Corinthians 6, 19 and 20. I'm reading from the NIV version. And the word of God reads, "Do you not know that your bodies are temples of the Holy Spirit, who is in you, whom you have received from God? You are not your own. You were bought at a price. Therefore, honor God with your bodies." And with that being stated, we have a delight, someone who is near and dear to my heart, someone who I trust literally with my healthcare plan, a dear sister, someone that I am absolutely certain you're going to glean from on today. So we're going to take a quick break and we'll be right back with my special guest today.
Faith, wisdom, word. Quality time with Najiyyah.
Welcome back to Quality Time with yours truly, Najiyyah. And I can take these glasses off now because we have in front of me a beautiful person that I can see right here without them. My friend, my physician, and a dear sister in Christ, Dr. Jelisa Timmons.
Hi.
Welcome. I am so delighted that you took time to be here today.
Well, thank you for having me. I'm really excited to be here.
Yeah, absolutely. And this is just a spoil alert. She is actually on the cover of the July issue of Diva Zone. So I'm helping you put a face with a name early. So Dr. Timmons, I want to just have the audience know something about you and your journey. You and I have discussed, I know where your home is and this and that, but I really want you to just introduce yourself to the Diva Zone audience.
Okay. Well, again, my name is Jelisa Timmons, and I was born and raised in a small town in Florida, Fernandina Beach, and very much so raised by my village. So my mom, grandmas, aunts, cousins, we all lived right down the road from each other. And so that's pretty much where my journey into medicine started, right? Just surrounded by my family, my upbringing, always taking care of people and each other.
Yes.
And so from that point, I went to the University of Florida. That's where I did undergrad. I went to medical school. And eventually made my journey here to Virginia for my family medicine residency training.
Okay.
And upon finishing training in family medicine, I stayed at the practice I trained because I was really passionate about academics and medicine. And I've been there it'll be 8 years this year in practice.
Well, I believe that I have been with you all 8.
I think you knew me as a baby doctor in my training.
Yes, as has my mom, Monica, and we just were so delighted. I will tell you that, I do want to know what influenced your thought, but before I ask you that, I have to just state that what was most impactful when we called, because our doctor, I believe it was Dr. Miller, he had resigned, he retired, and they placed us with you because they just, they spoke highly of you and said, you'll be in good hands. And, we trust the network. They've never let us down. And when I think mom's appointment was first. And so when she went and she saw you, mom came back just beaming with pride. You'd have thought that she was your mom. She was so proud And I just couldn't wait to meet you. And then, I know up not until recently, you didn't know that we were mom and daughter because we've just been
Eventually
your
I had to
patients.
connect the dots. I was like, wait a minute.
No, but, I was like just so excited because I'm like, this for me is just very significant because of the work that I do and to see, a woman who is just not, good at her job, but great at her job with so much beautiful bedside manner. I have to tell you, Mom and I are spoiled at this point. So I hope you love Richmond. Don't leave us.
I don't plan on leaving anytime soon, so you don't have to worry.
Okay, good. But tell us what influenced you to want to practice medicine.
Well, I think it all started back at home. Well, very early on, at first I thought I wanted to be a lawyer.
Okay.
It took one summer volunteering in my cousin's law office, and I knew that was not it.
Yes.
So I'm like, well, maybe I'm going to be a doctor. So the earliest introduction I had to medicine, there was an OBGYN back at home. His name was Dr. McGrath, and he would let me shadow him over the summer.
Okay.
And, again, I grew up in a really small town, so you had one of two OBGYNs. So he delivered all the babies on the island. He took care of pretty much all of my family, my mom, my aunts, my grandmother. My grandmother worked in the hospital that was at home. So he knew them too. So it was almost like he was family already. And then I just really admired the way he took care of the women in the practice. And I saw he didn't differentiate between whether you're wealthy, you had insurance, you didn't have insurance, young, old. He just had this mutual respect and kindness for every woman who walked through the door, no matter whatever the situation was. And I'm like, that's what I want to do. That's what I want to be for the community that I'm in. And I think I just tried as much as I could to bottle that up and take it with me. And I think just my upbringing and had a very strong matriarchal presence in my family.
Yeah.
So I think that part came naturally when it, came time to pick a career path that involved me taking care of people. It was kind of what I grew up doing, what I saw people doing. And then when I came across Dr. McGrath and just saw the way that he loved and poured into our community the way that he did,
Yes.
I really respected that and admired that. And so I think it was just really a blessing, that opportunity that I had. And I just try to, replicate what I saw and love on people the way I saw him and my family love on people,
Well, you do a fine job, and you are making him proud. I can go ahead and say that. And just publicly, I've been very transparent about some of my, medical journey. When I came back from Texas, I was in a disarray. Things were just off. By the grace of God, nothing serious, but I was nonetheless afraid. And I will tell you that I tell everyone. And I'm going to tell this audience, because everyone who knows me, I shared this testimony when, I got yet another second look at one of my test results. And you shared it with me when I came to see you just for some follow-up. And you asked me if I had seen it. And I just sat there and I literally tears just started rolling down my face because it was just too much. And ladies, this is why we are having this conversation today. By the grace of God, nothing was, serious. No surgeries needed to really be had to correct any problems. But I had some serious lifestyle changes that I needed to make. But before we got onto the business of that, you saw that I was afraid and you saw that I was emotional. And you asked permission, but you said, are you a woman of faith? I want to pray for us. Ma'am, I will tell you that you don't know the peace and you don't know how God used you in that moment, because I knew we never discussed it, but I could just sense the light in you. But to know that care was, taking care, and I'm getting emotional even thinking about it because, everyone needs that person that is not viewing them as a number, viewing them as the next person I need to see today to get on with my day.
Yeah.
And I felt like I was your only patient during that season of my life. So your follow-up in my portal, writing me back personally, you are just exquisite, ma'am.
Thank you. That
Dr.
means a lot,
Timmons.
you sharing that with me, which I really appreciate.
Yes,
So,
you really, you changed the way I viewed, just a lot, healthcare in general, just to see it, to experience it. I'm like, everybody needs this level of care. And while I know that's not the reality all the time, I pray that more physicians just understand that just those special little touches, along with that tremendous skill set, goes a long way in changing the lives of people. So
I mean, I really do feel like it's a call.
It is.
I know that the Lord is very intentional in what he
Yes.
does and where he places us, right?
Yes.
And I know I did not make it this far in medicine without the Lord, because I wasn't the top of the class. I might not have been the smartest person in the room, but I knew what the task the Lord gave me to do. And I was like, Lord, if you open the door, I'll walk through it. Even when I didn't see it and it didn't quite make sense, just, making my way through medical school, even some of the positions I have now.
Yep.
Sometimes you hear about imposter syndrome,
Yes.
right?
Yes.
Where you look around the room and there's just fear, like maybe somebody's going to find out that I really don't belong here, or I don't feel qualified enough. But, one thing I feel like the Lord has, I don't know, just given me or shown me is like, there's some places, we go into and you might be the only bit of Jesus that's in the room
That's
is the
right.
Jesus that's in you, right?
Yes.
And so, just trusting that the Lord is very strategic and intentional. And I really do feel like what I get to do as a physician is just an extension of the love the Lord has given me. I'm like, he's given me so much. He's forgiven me much. He's poured into me much. He's blessed me much.
Yes.
So I feel like the least that I could do is love on people this way, right? And so, I'm thank you for sharing those stories. And sometimes I'm in the room and you feel this like inkling or this urge. You're like, should I pray? And you're a little nervous. Are they going to be receptive? Or, but just kind of taking that step of faith and courage and just, hey, can I pray with you? And those are the days when I walk out of the room and I'm like, okay, yeah, like this is right where I'm supposed to be. Because, you have those other days when
Yes.
it's madness somewhere. I'm like, what am I doing? Right? But the Lord has been really faithful and really good. And it's really a unique way I get to really love on and pour into people. So thank you for sharing that with me.
Well, thank you for being you and giving me a reason to share. We are going to pivot for a second when we come back from break, because we are going to talk about a lot of the hidden things that you and I previously discussed just about women's health. So if you all would just be so kind as to look at these announcements that we have coming up, some really exciting things within the network that I'd like for you to see. You can go to the website and see more about this information. And of course, you can always reach out to us on our socials if you would like to communicate with someone or have a conversation. But when we come back, more with Dr. Timmons, and we are going to dive into some stats. You don't want to miss this. We'll be right back.
Wisdom, word. Quality time with Najiyyah. Faith, wisdom, word. Quality time with Najiyyah. Quality time with Najiyyah.
Welcome back to Quality Time with yours truly, Najiyyah, and we have some wonderful content, ladies. I want you to stop what you're doing, and I want you to hear ye, what I believe to be the word of the Lord in this season. We have got to be more deliberate and intentional about the care for our physical temples, our holistic beings. We are triune. It's not just one-sided. And while many of us put a lot of effort into our spirituality. Today we are talking about our physical bodies very specifically. And if you're just joining us or, coming back from the break, I'm still talking to my lovely friend and physician, Dr. Jelisa Timmons. And now, Dr. Timmons, we're going to pivot and, get into some stats. So I do need my cheat notes to make sure that I don't leave anything out. Our audience is primarily African American and Latino women. 35, but truly more like 45. We have probably 8% are between 35 and 40. Okay. The rest are 40 and above.
Okay.
And while we do have some Caucasian and Asian women are the core of us, are African American and Latino. Would you mind sharing some stats about the health concerns that you see as a doctor plaguing these communities specifically?
Absolutely. I think it goes without saying there's no secret that there are significant disparities in medicine among women, right? But especially among Black and Hispanic women, right? And so, I know a lot of these things and I know some of the numbers, but it's very sobering when I, just kind of been preparing for a talk, when you look at some of the numbers again and reminded of some of the health, pretty much like crises and dilemmas that we're faced, right? So when you look at what is the number one killer among Black and Hispanic women, right? Black women, especially cardiovascular disease, right? And so it's estimated that about 50% of Black women over the age of 20 have high blood pressure, but only about 50% of them have controlled high blood pressure, right?
Wow.
So it's already really concerning right there.
Yes.
Okay. When you look at even specifically in Hispanic women, about 42% are estimated to have some form of cardiovascular disease, and about a quarter of them are more likely to have poorly controlled hypertension, right?
Wow.
So high blood pressure, heart disease is a big one in our community that we have to shift our focus to and address, right? Just some other numbers. So part of my practice and what I do is weight loss and obesity medicine.
Yes.
And so among Black women, about 55 to 60% of Black women over the age of 20 have obesity, compared to about 36% of white women. And about 47% of Hispanic women have obesity, right? And then when you look at some of the rates of diabetes, now these are some of the numbers I was like, man, we are nearly have double the risk of having diabetes than our white counterparts.
Wow.
About 11 to 13% of us have it. And then they think that the prevalence is actually closer to 20%, but a lot of women just don't know that they even have the disease, right? So it's about, 10 to 15% we know, but it might be as high as 20%. It's just a lot of women don't know, right?
Wow.
And then when you go into cancer risk and, death from cancer, we pretty much lead in mortality of multiple cancers. Breast cancer, colon cancer, cervical cancer, endometrial cancer, right?
Yes.
And unfortunately, a lot of women present later in the disease process and for some reason tend to have more aggressive cancers too, right? And so there's probably a lot of factors that go into it. Either just the lack of care, where there's barriers to getting care, lack of insurance, access to a good provider or place. Some of the other things, though, is there's a lot of mistrust, within the medical system. There's concern, if I go to my doctor with my symptoms, are they going to listen? Will they downplay my symptoms? Right? There's been a number of studies that have shown that people underestimate the level of pain in Black patients compared to white patients and are less likely to treat their pain.
Wow.
Same thing comes to women and women's health. When I go in and tell you that my belly hurts or I have pelvic pain or I have abnormal bleeding, are you going to listen to me? Or if I go tell you, are you going to do the appropriate workup? So there is some just the systemic racism, disparities in medicine. So we're up against a lot and we have much higher numbers. So I'm really glad that we're having this conversation to address it, because it's a conversation that we need to have and keep having so that we can see some change.
Absolutely. That is startling. And quite concerning.
Yes.
And again, I'm happy we're having this conversation as well. But ladies, I pray that you are taking these stats to heart because they are affecting us in tremendous ways. Uh, I want to talk about menopause for a second because that is big on the radar. And God knows you helped me through my season of private summers quite well. I'm so glad. I'm shouting from the mountaintop that that is over for me because I didn't think I was going to be able to deal. I didn't think I was going to be able to deal much longer. But many of our followers are dealing with the newness of the issues that come upon us during that season of menopause, menopause. Can you explain the stages of menopause and some of the early symptoms that many sisters experience? Like, I know the hot flashes, most of us do, and in my peer group, the relentless weight gain, normally around the midsection, are the biggest issues. But if they're unbearable, can they be managed with medication? And what signs might people start experiencing when they're not quite at menopause, but just about to start?
Sure. I think for starters, we'll give menopause a little framework, right?
Okay.
So we have to remember it's not a disease, right? It is
feels like one.
I know, right? It is a normal process, right?
Yes.
That everyone will experience. If we live long enough to make it to that point, we will
Yes.
all experience the state of menopause, right?
Yes.
So it's almost like you have to look at it as it is your new hormonal balance, okay? There's a lot of big changes that happen in our bodies, right,
Yes.
around the time of menopause. So a lot of times you'll hear about perimenopause. Now, this
Yes.
part is rough, okay? Now, it can start mid to late 30s, but for the majority of women, it's usually once you get into your mid 40s where you start noticing some symptoms, right?
Yep.
So you start having fluctuations in your body of the normal reproductive hormones, estrogen and progesterone, and it affects a lot of different systems in the body, right? The brain, that's why you end up with the hot flashes, brain fog, irritability, skin, bones, different tissue in the body, even the heart, right?
Yeah.
But a lot of times in perimenopause, it's rough because why am I having hot flashes and still having a period?
Right.
Like something's got to give,
Yes.
right? And then your periods become more unpredictable.
Yes.
It can feel like a hot mess for a lot of women. Once you're at that age, you're like, am I in menopause? Am I not in menopause? I didn't have a period for 3 months. All of a sudden I'm having a period and a hot flash. Like what is going on in my body, right? So there's a lot happening.
So unfair.
I see a lot of distraught women during that period of time. Menopause is defined as 12 months without a period, right? 12 calendar months without a period. So and the average age in the U.S. is about 51. It can be a little bit earlier in Black and Hispanic women, but generally around the early 50s. I tell a lot of women, when did your mom experience menopause?
Yeah.
That's probably the closest insight you have to when you'll probably be experiencing menopause. But menopause is 12 months without a period, all right? And it's really important to, especially once you're in perimenopause, those periods really start spacing out to try to keep track.
Yeah.
Because something that's really important and every woman should know is that once you've experienced menopause, you've hit 12 months, you have not had a period, and now we're post-menopause.
Yeah.
Any bleeding after that point is abnormal and you need to go see your doctor, okay? Can be the earliest sign of some type of abnormal cell growth or changes inside of the uterus, right? If it's 3 years and you've never had a period, all of a sudden you're bleeding, you need to go see your primary doctor, your OBGYN, okay? Don't ignore it or try to explain it away.
Yes.
That's
good.
Yes.
Yeah.
But postmenopause, it's, once we've crossed that threshold, right? Your ovaries have fought the good fight and they are done, right? So we're done producing estrogen, we're done making eggs. And so now that's where, especially earlier on in menopause, is when you can have a lot of symptoms, right? Again, the brain fog, the irritability, the hot flashes. Some have difficulty sleeping at night. And it even, years down the road can impact your bone health. You hear about risk of osteoporosis, osteopenia, because estrogen was really important in bone health too, right?
Yes.
And so, you can experience a lot, but usually as the years go on, the symptoms start to die down and improve.
Mm-hmm.
There are a few, one thing you asked about was, well, what can we do about it? Treatment
Yeah.
options, right?
Yeah.
Lifestyle is one big piece. I know we're focusing and
Yes.
talking about that quite a bit. So even things like exercise can help with your mood and how
Yeah.
you feel. A healthy diet is important too, just making sure you're giving your body good things.
Mm-hmm.
Good sleep is important. Sometimes easier said than done when you're having your personal summer
Right.
in the middle of the night.
Yep. Yep.
But still really important to how you feel overall. There's also, options of hormone replacement therapy for some women that is a good option, appropriate to help with some of the symptoms that come along with menopause.
Mm-hmm.
And then there are some non-hormonal options, sometimes certain antidepressants, or there's some other newer medicines that can help with the symptoms of menopause too,
Mm-hmm.
especially if you're not a good candidate for hormones for whatever reason, or you just prefer not to do any hormone therapy.
Okay. That's really a wealth of information. And ladies, you're welcome. Because of the conversations that we have, those are definitely some of the top things that we talk about. So, just overall lifestyle changes, these things that are plaguing our communities, what are some of the things, aside from the exercise? And let's I guess really explain exercise. Is this just walking? Is it, jogging? Is it, a serious cardio workout with a trainer? Can it be subtle lifestyle changes that people make to improve the circumstances?
Sure. The recommendation, right,
Yes.
is 150 minutes a week of moderate exercise. So
Okay.
something that gets your heart rate up and going,
Yes.
right? And then when you do the breakdown, about 30 minutes, 5 days out of the week,
Yep.
right? But I think the most important thing is that you move your body and that you start, right?
Yes.
And it can be as simple as walking. Walking can really do a lot. It helps with, your mental health and your physical health too, right?
Yes.
A body in motion stays in motion. Once you start to lose, especially as we age and get older and you start to lose some of that mobility, become less and less active, it's a lot harder to get that back than it was, right, before.
Yes.
And so even if you decide, all right, I'm starting with 10-minute walk in my neighborhood or around my yard or working in my garden, things that you can get your body moving more and more day to day is great. Even at work, some people I'll see at their lunch break, well, let me take 15 minutes. I'll do a walk around the parking lot or I'll walk to grab my lunch. Little things like that can go a long way. Home exercises. The gym can be really intimidating, right?
Yes.
And it's not all or nothing. You don't have to go to the gym. YouTube has so many different activities and things. You can go online and find you a quick workout that you can do right at home without any equipment, right? It's just carving out that time to make ourselves do it,
Yes.
That can be easier said than done. But I think the most important thing is just starting, getting active and getting your body moving.
Yeah. And I know that we didn't talk about this previously, but I know and have learned hydration to be so important, even in the aches and pains that I was feeling. So that's something, ladies, these are things that we can do and we will do, but all of us are not cut out for the gym. Mom and I, we actually, you'll be proud of us. We are walking 6 miles weekly.
That's awesome.
Yep. Right around the development. We are, we're breaking it up over, 3 or 4 days. But I've been doing a lot of work in the garden as well and did not realize. I got on the scale the other day and I was down 5 pounds.
All right. That's awesome.
And I wasn't even trying. So that was like really encouraging. So I'm just encouraging you ladies that if someone like me who sits all of the time, which is not good for us, and most of us do, if we just got moving more, we would improve and be able to turn around some of these statistics. I don't want that to be our narrative.
The other thing I'll mention about exercise, especially post-menopause, is any type of resistance or weight-based exercise is really important too.
Okay.
Because strong muscles helps to promote strong bones. So that's one of the way that you can help prevent or slow the progression of things like osteopenia and osteoporosis is actually by building good muscle. And again, it doesn't mean you have to go to the gym and get to the bench press, right?
Yeah.
It could be as simple simple as resistance bands or resistance like exercises like squats and lunges, things that help build your core too. So that's important to, eventually incorporate. But again, most importantly, get up and get moving. At least starting, I think, is really good.
So like the little free weights can
Mhm.
also be an
Little
option,
handheld
even when
weights.
walking.
Yep.
Yeah,
Mhm.
I'm going to do that. Thank you for that. Mood swings. Our male counterparts, and pardon me to the males that are in the room, they sometimes think that we are just being dramatic, okay, with the mood swings. I know them to be real. PMS and through menopause. What is triggering? What is happening, in our bodies at the time when we are experiencing those highs and lows like that?
Yeah. So, guys, we are not crazy. We are not just
Did you
being
hear
dramatic.
That? We are not crazy.
Let's see. And I was really glad that you had that question. When I looked at it, I laughed a little bit, but I'm like, no, this is good.
Yeah.
So it's normal. We have normal fluctuations of hormones in our body, right? And so even before menopause, we have normal fluctuations that happen in the reproductive hormones so that we have a cycle. It's like every cycle your body gets ready to have support life, have a pregnancy. If not, you go through the cycle again, right? It's normal. It's what happens. And so but there's some changes that happen. So right before your period, you have a significant drop or a change in those hormones, just like you do similar to like around menopause, but they make like the ultimate drop around menopause, right? And so it's normal to have some of those changes. You can have some women can feel really emotional or sad or anxious, right? Others feel more irritable or kind of sensitive to all the noises around them.
Yes.
Sometimes you can feel just physically, you feel drained, you feel run down, you feel bad. There's some women who experience really, really heavy periods and heavy bleeding, right? And if you have anemia or low blood counts, that can make you feel like you're dragging and more tired too. And so it's not in our heads. It's from the hormones in our bodies changing because they do impact our brain. These chemicals work in our brains to help regulate a lot of things, right? And some of it is normal, right? It's normal to have some mood changes, but then there's certain things like premenstrual dysphoric disorder. So if you have really extreme changes or really deep lows in your mood and in your emotions around the time of your periods or your menses, that would be a good time to talk to your doctor, because sometimes we have to intervene with certain medicines to help regulate, just some of the hormonal changes or the emotional changes that happen, right? So it's normal to have some, but if you feel like those things are more extreme, then you do want to seek medical attention.
I appreciate that. And again, we are not crazy. Pap smears. That was a joy for me to realize that, that's no longer an annual, festivity. But when does that change?
Okay. So for starters, Pap smears, which is your cervical cancer screening, so that's your screening for cancer of the cervix, they start at the age of 21 now, right? Regardless of sexual activity. So 21 is when we start doing those screening tests, right?
Okay.
And now the testing is every 3 to 5 years, depending on the type of test, if it's normal, right? From the age of 21 to 29, it's every 3 years if they're normal. And from 30 to the age of 65, it's every 3 to 5 years, depending on whether your doctor checks for HPV, your human papilloma virus, right? And so once you're at the age of 65, if you've had normal pap smears, so at least 3 of the regular paps, or you've had 2 paps with a negative HPV in the prior 5 or 10 years rather, what I like to say, you get to graduate from having pap smears anymore.
Okay.
So 65 is usually cut off, but as long as you've had your regular interval checks and follow-ups, and they have been normal, then at 65, you don't have to get any more. Okay. Some women have hysterectomies, right?
Yeah.
Now, if you've had a hysterectomy and your cervix has been removed and it's for benign reasons, so non-cancer reasons, then at that point, you don't have to get pap smears anymore.
Okay. I'm sure that made someone's day. It certainly has been good to me.
That's
We have to go
hilarious.
through so
Mhm.
much. My word.
I'm like most women. I'm like, you graduate from PAPS. They're like, what?
Oh, yeah.
Yes, thank you.
I know. I tried to schedule. I think when you know this, and then you're like, it's not time. Like, all right, well, great. Okay, and so there are many women that I talk to who are battling with weight
Mhm.
right now, and this, all of the information circulating about the injections
Mhm.
and all of the advertisements that you hear. What do you have any advice for anyone who might be considering doing that?
Sure.
Yeah.
Mhm. So, I mean, I do utilize those medicines a lot for patients and weight loss.
Uh-huh.
They do work very well because they're one of the first medicines now that we have that help treat obesity and weight related issues at a hormonal level, right?
Okay.
All the other medicines just work on your brain to tell your brain you're not hungry, don't eat, or to
Okay.
boost your metabolism some. But now we have something that works at a hormonal level, right? So
Okay.
it's good. However, I think we have to remember that it's just one tool that we use to help us towards our weight loss goals.
Okay.
And so that's why the lifestyle piece is very important.
Yeah.
And so I think the most important thing is to see, are you making the appropriate lifestyle changes,
Mhm.
right? To lead towards a healthy lifestyle. And then really talking to your doctor to see what you're a good candidate for, because even some of the other medicines and the pill forms can be good if appropriate for you. I would be careful of a lot of the advertisements and things you see on social media or on TV, especially around the medicines that are compounded.
Okay.
It can be a challenge because the medicines are very expensive, right? And for some patients, the only way that we can get them these medicines, which are very effective and helpful, is, do we go the route of a compounding pharmacy? But you have to remember those are not regulated by the FDA, right? So
Okay. That's very important.
it's
Yeah.
the quality controlled checks just aren't there for some of the compounded medicines, right?
Uh-huh.
So I think really having a conversation with your doctor or provider that you trust to determine is this a good next step for me is good. But also checking with your insurance. Some insurance plans
Mhm.
will cover it if you go through the appropriate avenues or things. But I think the most important thing I try to tell people is like, this is just one tool we can use. And for some patients, it's appropriate. But again, be careful of some of the online cash only,
Yeah.
you just have to be careful because they're, not always as good as they may seem.
Yes.
And these medicines are not without risk too. So you want to keep that in
Yes.
mind.
Absolutely. Ladies, I hope you take heed to that. We're going to take a really quick break. And when we come back, we're going to wrap up our delightful and I know well informative conversation with Dr. Jelisa Timmons. So take a quick break, look at some of these announcements which are coming up. You can go to the website and see the same. But in the meantime, we'll be right back with the conclusion of this podcast.
Faith, wisdom, word. Quality time with Najiyyah. Faith, wisdom, word. Quality time with Najiyyah. Quality time with Najiyyah.
Welcome back to Quality Time with yours truly, Najiyyah. We have been having a wonderful discussion with Dr. Jelisa Timmons. I invite you to share this quality information. Not only are we having quality time right now, but we are sharing some really significant information. And I believe that it's something that is going to be a blessing to men and women in our lives. So just make sure that you take heed. Ladies, it's so important that we focus on ourselves, put ourselves as priorities on our list to make sure that our temples are cared for. And with that being stated, Dr. Timmons, let's just continue the diabetes.
Mm-hmm.
I know so many people
Mm-hmm.
that are experiencing that, but some are learning that they are like pre-diabetic.
Yeah.
Okay, can you explain that And then, what can you do to kind of keep it there or roll it the opposite direction
Right.
before it goes into full-fledged diabetes?
Sure. A lot of times the challenge with issues with your blood sugar, right? What we call pre-diabetes is you have higher blood sugars, but they're not to the point of diabetes, right?
Uh-huh.
A lot of times you don't feel anything. You don't feel any different. You don't necessarily have any symptoms,
Yeah.
right? So I think that's why it's important, just making sure you're getting your screenings, your annual physical, and your checkups, because sometimes, we can catch things early.
Yeah.
And so, some of the symptoms you hear about with really high blood sugars that might be to the point of diabetes is, excessive thirst,
Yeah.
excessive urination or having to pee a lot,
Uh-huh.
changes in vision or blurry vision. Those are, some of the main symptoms like you'll hear about or you could experience. So if you're experiencing any of those, please go see your doctor.
Uh-huh.
And so really the hallmark of if you know you have prediabetes or you found out that you have, earlier on diabetes, the best way you turn that around, I think, is lifestyle. One of the biggest culprits that I see both in prediabetes and in diabetic patients is the sugary drinks. If I could tell people to stop doing one thing,
Yeah.
right? The lowest hanging fruit, even when I start talking to people about weight loss and those things, is cutting out the sugary drinks, right? So the sodas, even the 100% fruit juice, and we're in the South, so yes, that
Yes.
includes sweet tea.
Yeah.
I have some patients that are like, "Well, I just drink tea." I'm like, "Is it sweet tea?"
Yes.
And so you have to remember that sugar in a very pure and potent form. So you drink it and your blood sugars shoot up, right? And so you have to be very careful of that. And even, a lot of people will drink sugar alternatives or diet drinks, but, there's some studies I think that might actually be a fast track to diabetes. So you have to limit those. Now, I love me a Coke Zero or a Diet Coke here and there, right? But that needs to be more the exception to the rule and not your daily drink, your daily intake. So drink water. Add some fruit infused water, sparkling waters, all those things count, right?
Yep.
And so that's one big piece with lifestyle. But, I think and looking at some of these numbers is, man, there's so many of us walking around that might actually even have diabetes and don't know it, right?
Oh, wow.
So you have to get screening it checked because diabetes impacts some of the most delicate blood vessels in your body, which are in your kidneys, in your eyes, in your heart, and then the tips of your fingers and toes, right? So we know about, and we've heard stories about people who've had to be on dialysis or had kidney disease, or, it's also, it contributes to heart disease, heart attacks and strokes. It's a big risk factor. Or that's why you get your eyes checked regularly because it can impact your eyesight. Or you hear about people with neuropathy where they can't feel their feet and their toes or their fingers, right? And it's one of those things where, a lot of patients say, well, I feel fine. But, a lot of times when you feel the effects of diabetes, at that point it's too late. And we may or may not be able to reverse or turn some of those things around. So I think, again, really the hallmark of what we've been talking about is just really lifestyle, taking care of your body. Some people, I feel some women don't go because they're afraid, right?
Yeah.
What if I go and I do have diabetes? Well, mom had diabetes, grandma had diabetes, dad had diabetes or high blood pressure.
Yeah.
And sometimes the not knowing might feel a little bit more comfortable than actually going in and facing that something might actually be wrong.
Yeah.
And I think a lot of times as women, like your mom, your friend, your sister, your career woman, right? Your wife. And we end up taking a back seat and on the back burner for everybody else's healthcare needs, right? And so we have to make sure we're putting ourselves at the forefront to take good care of ourselves so we could take good care of other people, right?
Yeah.
And so I think the really big thing is making sure you're getting things like your blood sugars checked. And I think we'll talk about blood pressure, have your blood pressure numbers checked too.
Yeah. That's really good information. Yeah. So many people are like straddling the fence and don't know. And you're right. There is a fear factor in finding out. But we have nothing to fear when we have doctors like this. Go see my doctor, but just don't take my word. But the screenings, you are an advocate for them, and we always discuss them when I'm there for my annual and follow-up appointments. What screenings should we make as part of just our annual wellness plan?
Yeah. So I think kind of what we just talked about is one of the big things is getting your blood sugars and your blood pressure checked.
Yes.
Okay. Because blood pressure is another one, just like diabetes, where you might feel fine and you don't feel anything, but there's something going on,
Yep.
right?
Yep.
And these two are diseases that cause issues over time, right?
Yeah.
And so those are probably the most important. So going in and getting labs checked, getting your vital signs checked, where they'll check your blood
Yep.
pressure to ensure everything's good. I think too, especially knowing most of the audience is, you said what, beyond the age of 40.
Yes.
So a lot of times we're getting to the territory of our cancer screening.
Yes.
So breast cancer screening, so getting your yearly mammogram.
Yes.
Your doctor may or may not do the breast exam. That's kind of fallen out of practice so much now. But I do tell women, like, do your self breast exams. Be
Yeah.
familiar with what's normal with your breast, because
Yes.
if you notice a change, you need to let your doctor know.
Yeah.
Right? We've all heard a story or had somebody close who felt something and it was something,
Yes.
right? And so it's better to be checked out to make sure it's okay than to try to hope and wish it away, right?
Yeah.
Your cervical cancer screening,
Yeah.
colon cancer screening starts at the age of 45.
Okay.
And so that is another big one, another really important one to get screened for.
Uh-huh.
And then, of course, for some women, if you are a smoker, lung cancer screening could be another one. If you're a smoker, stop smoking.
Yes.
We're going to help your overall health and your heart
Yes.
and cancer risk. But sometimes that's appropriate too. So I think that's the most important thing, is being checked, getting your screenings, and then also talking to your doctor about your family history.
Yeah.
If you have family members who've had various cancers, breast cancer and colon cancer, ovarian cancer, those are really important, because sometimes it impacts when you start your cancer screening, right? If you had a significant family history of breast cancer or colon cancer, you might actually start before the recommended ages for these cancer screenings.
Okay.
So that's really important to, know what your family history is too, because it can impact at what point we do your screenings and your checks.
Okay. That's really good information. Thank you for that. HIV and other, sexually transmitted diseases, is it still on the rise for our communities? And, is there an uptick in the senior population with these? I've heard varying discussions about this, and I want to hear from you, and for you to just kind of provide the statistics if that is the case.
Sure.
Yeah.
So I was a little surprised when I saw some of these numbers. So to answer your question, yes.
Wow.
So when they did a study, it was from 2020 to 2023. The 65 plus group had the highest rise in STI rates at 24%. This was HIV, syphilis, gonorrhea, and chlamydia.
My word.
And it's attributed to later sexual activity later in life.
Yeah.
And lower condom use, because the risk of pregnancy isn't there.
Right.
Okay. So that's a big one. And then, a lot of times, as you get older too, you'll find providers might be less likely to ask you questions or offer you STD screening unless you volunteer up yourself, right?
Yes.
So just make sure you're advocating for yourself. If your provider isn't offering or bringing those up, that you bring those conversations up and you insist on getting STI testing too, because we do see new rates of or new cases of HIV and other STIs.
Yep.
One of the things I did find too is that Black women are diagnosed at 10 times higher rates than white women, and make up about 50% of all new cases of HIV.
Wow.
So we need to be very intentional about protecting ourselves too, because that was a pretty startling number when I saw that.
That is remarkable. Yeah, we really need to advocate for ourselves. And the older we get, if you are sexually active, there's still a risk.
Yes.
And that's just the reality. And so we need to, make sure that we're seeing about ourselves. Now, as a woman who is so busy and focused on this thriving practice that you have, how do you balance that with your home life?
That is a great question and probably ongoing. But a lot of grace. Fortunately, I'm very blessed. My husband is, we very much so have a partnership at home, right?
Okay.
And so, if we got to pick up the slack for each other,
Yes.
we really try to do that. We have, I probably shared with you a few years ago, but I became an instant mom.
Yes.
So I have 3 boys at home.
Yes.
And so they keep us very, very
Yes.
busy. And so what I've found was, though, I have to be very much so intentional about setting certain boundaries.
Yes.
That's one thing I really had to learn, because there's a big transition from, I was single, just I could dedicate a lot of time to my work and what I did.
Yes.
And now I have to be mom and wife.
Yes.
And, so I've had to learn how to, all right, it's time to, close work
Yes.
and go do X, Y, and Z and, spend my time with the kids or
Yeah.
at home.
Yes.
So it can be a challenge, right? But at the same time, I think I'm learning, and then I just have to give myself some grace too, in that, it's okay. I'll miss things here and there, whether it's miss things with work, miss things with the kids.
Sure.
But just trying to learning like how to find that balance. And I don't know. I think as women, we know and can share that it probably changes from season to season, right? Depending on
Yes.
what's going on. But just trying to. I think I have to, just like I'm telling everybody else to be in tune with your body and your
Yes.
mind, I have to make sure I'm doing the same thing too and listening. All right, what are my cues when I'm feeling drained?
Yes.
What are my cues when I'm feeling sleep deprived? What are my cues
Yeah.
when I'm feeling empty or that I'm running on E? And how do I become intentional about making sure I'm filled up, taking care of me?
Mhm.
Because I think, in that transition to motherhood,
Yes.
I would hear a lot of patients or a lot of women tell me and talk about, I'm telling them we have to put your health at the forefront. Like you're
Yeah.
on the back burner. I tell people all the time, probably told you, I'm like, it's your job to take care of those people at
Yes.
home. It's my job to take care of you,
Yes.
right? And help advocate for you
Mhm.
and help you get some skin in the game too, right?
Yes.
And so, there was a sign I have at home and I like, and it says, Lord, make my words sweet like honey, because one day I may have to eat them.
Oh, that's good.
And so now I'm like, oh, now I understand.
Oh.
Now I see how easy it is to put myself on the back burner to
Yep.
all of these other responsibilities and things.
Yes.
And it's really easy to do. And you look up and realize, like, when was the last time I was in my garden? When was the last time I took a walk? When was the last time I had a moment to just take a breath,
Mhm.
and trying to be intentional. So I'm learning. It's ongoing.
But that's a blessing. And thank you for being
Mhm.
so transparent in that, because so many of us are professionals and do so much. And,
Yep.
and it's, I think it's a balancing act that is like that dance you have to perfect
Yeah.
over time,
Mhm.
because it really, you have a lot going on.
Yep.
Most of us do.
Mhm.
So are you taking new patients at your practice?
I am not at the moment. They
Okay.
have shut me down.
Okay. Well,
Meaning my panel is closed right
okay.
now, but our practice is, of course, taking new patients. So I work
Yes.
at St. Francis Family Practice with Bon Secours.
Yes.
And we are primarily a resident run or a teaching practice,
Mhm.
which part of the reason I stayed is I am very much so passionate about education and teaching,
Yes.
training the next generation of doctors. So you probably know this. I usually have a medical student rotating with me.
Yes.
So you
Yes.
probably see a student as much as you
Yep.
see me. But yeah, I really do love that aspect. So for some people, it can be an acquired taste having trainers or learners that are physicians, but taking care of you. But that's something I'm really passionate about at our practice. And,
Yes.
I feel very fortunate I get an opportunity to do.
Yeah, and you're great at it.
So
And
thank you.
they're great. You're teaching them all wonderful things. They're going to be great. I've never minded them being there, by the way. That's just me. But what would you say to a young lady who has aspirations of being a physician?
I would make sure she knows that you can do it.
Uh-huh.
You can, if you're watching this, right, and you're thinking about it and you feel called that you want to be a physician, you can do it, right? Don't let anybody tell you can't do it, right?
Yes.
There, as women, as Black women
Yes.
especially, there's a lot of cards that can be stacked against you.
Yep.
But as we see, even in our
Yes.
relationship, like your presence is needed,
Yes.
right? we need more providers that look like us,
Yes.
right? I can't tell you how many, you included, women I encounter, and they're like, thank you for being here.
Yes.
Just thank you for being you and seeing me, right?
Yes.
And a lot of times as women, we just want to be seen and heard.
Yes.
Like, even if,
Yes,
okay,
Lord.
you don't order a test, or even if it doesn't, like, I think I'm dying, I'm like, I'm telling you, you are fine. You're right. You just want somebody to see you and to hear you and validate your concerns, right?
Absolutely.
And sometimes just being in that safe space is somebody who understands you as a woman, who understands the cultural background, the context, the different challenges that we're up against in our different spheres of influence is really important. And so, I'm like, hey, if you are a young woman and you're thinking about going into medicine, like, medicine needs you probably now more than ever. And so I think a couple of things that come to mind, though, it's not easy. It's a journey. Yeah. It's hard, right? The physician, I told you all about the OBGYN I worked with, Dr. McGrath, he told me, he sat me down, he said, I want you to remember 2 words. Delayed gratification.
Wow.
And it has stuck with me. He said, you have a long journey ahead.
Yeah.
And you're going to look up around you, and the other girls might be married, having kids. They might be buying houses and traveling the world, and you will still be in school. And I was like, are you supposed to be encouraging me? And he was like, but you stick with it, and it will be worth it in the end. Delayed gratification. So I think and that's something that still kind of sticks with me, and I had to hang on to that when I'm going through it, and this is hard.
Yeah.
And I think the other thing too is when you're doing something that the Lord called you to, He's not going to put you in anything that you can't make it through with Him, right? And so there's so many times where I'm like, Lord, the math is just not adding up, but the door is open.
Yeah.
And so it's just trusting that the Lord will help you. And I feel like I have really gotten acquainted with that in my journey in medicine. But, I think the important thing is, hey, look at me. I did it. I'm here. So you can do it, right?
Yes.
And I mean, medicine just really, really needs it.
That is such a blessing. You are a blessing. This beauty is gracing the cover of the July issue of Diva Zone magazine. And Dr. Timmons, while I know the wealth of information that will be in that interview will bless them, can you maybe drip a little bit? Will you contribute occasionally if I ask nicely?
Absolutely.
To our other publications?
Because I love you. But also, I love the work that you're doing. I think we need this space that you're creating, right?
Yes.
A safe space to express these concerns, to address them. Because a lot of times we have questions.
Yeah.
And you don't know where to go with them. But if we're already like, you are putting the questions at the forefront already, it's like you don't even have to wait to ask. I got you. All right, let's talk about menopause. Let's talk about high blood pressure. Let's talk about weight management. A lot of the questions that we have, and thank you for putting them at the forefront, so that, we're asking the questions that maybe we didn't even know we needed to ask.
That's true.
And you're putting them out there. So thank you.
Well, thank you. Thank you. And you all are always a gracious audience. Thank you so much. Share this content, create conversations around this content. If you would like to have a Q&A session with Dr. Timmons, and we can schedule it, and, maybe we can do that. Absolutely. For the audience after you see this content and you have questions, or if you just want to send them in, how we do, and I will ask on your behalf. We will have as many follow-up conversations as necessary, because we are triune beings, and it's not just about our spiritual health, but it is absolutely about our physical health. And the Lord owns these bodies. We have got to be good stewards over these temples, because this is our earth suit. We don't get another one, right? So as long as we're here, we have to take care of the skin we're in. You have been a blessing. Thank you again, Dr. Timmons, for being here.
Thank you.
Until next time, thank you for watching Quality Time.
Faith, wisdom, word.